Hi, this is Len Berman, and welcome to CEO Unplugged. Today I'm sitting down with Dr. Sharma. He's the Executive Vice President for Clinical and Professional Affairs and Chief Medical Officer from South Nassau Communities Hospital, and Dr. Klein, President of Mount Sinai Health Network. Welcome, gentlemen. So, what was the genesis of a partnership between Mount Sinai and South Nassau?
Well, I'm happy to take that first. Mount Sinai decided, with all the changes occurring with respect to insurance, population medicine, expectations of communities about enhanced local care, that it needed a strong partner on Long Island. That was also prompted by the fact that from a capacity point of view, we're pretty chock full in Manhattan. We recognized that South Nassau was a phenomenally important asset, both with respect to its location and, quite frankly, with respect to its quality and its medical staff. And we entered into an environment in which we tried to impress the South Nassau Communities Hospital that they would be a good partner for Sinai.
Dr. Sharma.
From our perspective, we had been a longstanding community hospital with advanced services, and despite our name, we were getting to a close tertiary care level, which is complex care. But many of our patients were still going to the city to get the higher level care, and the Board of Trustees felt it was very important for us to bring complex care to South Nassau. And we could think of no better partner to help us advance the clinical programs at South Nassau than the clinical leadership at Sinai.
So what is the ultimate goal of the partnership?
Well, from Mount Sinai's point of view, it's to create a tertiary destination hospital on Long Island that is up to the standards of clinical care, teaching, research of Mount Sinai.
So the question is, if you live on Long Island, do you have to travel to the city to see Mount Sinai doctors?
And the answer is no. First of all, we are giving many of the doctors at South Nassau Communities Hospital, Mount Sinai, appointments. Also, in cooperation with leadership like Dr. Sharma, we're recruiting new leadership to South Nassau Communities Hospital who represent the important services that we plan to put there.
So it sounds like, Dr. Sharma, I don't want to put words in your mouth, but it sounds like the association with Mount Sinai raises the level or the importance of South Nassau.
Certainly, it is an important factor for us, and in Dr. Klein's efforts, we've been able to recruit physicians to South Nassau that previously might not have come there. The caliber of physicians certainly is improved. We have quality physicians already, but we're adding physicians in areas we've never had presence before. So this is great.
I would add something else. Mount Sinai is a long-standing leader in the United States in medical education. It owns its own medical school, the Icahn School of Medicine, and is the largest trainer in the United States in graduate medical education. And one of our missions, one of our goals with respect to South Nassau Communities Hospital is to make it a bigger teaching institution. So, for instance, this coming July, we'll begin a new residency in internal medicine. That's both important to our mission, and it's also important to creating a workforce on Long Island that will be permanently there, holding up to our standards.
Well, that led right into what about the medical school on Long Island. Will residents train at South Nassau, and will they be part of the Icahn Medical School?
And the answer is very simply yes. There were already some very good residency programs at South Nassau. Part of our commitment to South Nassau was to increase those residency programs in new areas. All of those residency programs, effective July 1st, will be affiliated with the Icahn School of Medicine.
Dr. Sharma, what are you doing to expand patients' access to the advanced services that the partnership is going to provide?
We've done multiple things. On one end, we have actually Sinai physicians who have time now at South Nassau campus. So what that means is that patients who need to see, let's say, a open heart surgeon, we have slots available for those patients to see the surgeon. If they do need surgery, currently they will go to Sinai to have the surgery, but all their post-op care and follow-up visits can be done close to home. So this reduces the burden on patients who are already carrying the burden of their disease. And then we also have access through our network with the Sinai ambulatory platform that exists on Long Island currently. So partnering with them with their offices in Hewlett, offices in Manhasset, offices in Cuba Hill, we have increased access to patients throughout the island.
There's another aspect of this, which is South Nassau Communities Hospital had some assets that Sinai did not have, which it decided it did not need to duplicate, since South Nassau Communities Hospital could be a center of excellence for that. So one is a piece of equipment called a gamma knife, which is very important in the treatment of some cancers. we decided that rather than replicate that resource in the city, South Nassau Communities Hospital would be the destination for that therapy for the entire Mount Sinai system.
So what do patients do? How do they find out where the medical staff is? How do they make appointments?
So for patients that are new, they can go to our website, and they can, depending on what they're looking for, what type of specialist, the website can drive them. So they go to southnassaw.org. They can find the specialist that they need for their specific disease issue. And then if there is a Sinai specialist that would better serve them, we would connect them to that Sinai specialist. And that Sinai specialist may have hours on the South Nassau campus or may not, but it will be very specific to the disease state.
So with respect to patient access, number one, we will be combining all of the web-based technologies at South Nassau with Mount Sinai. So they will be part of our overall web technology and a part of our overall web strategy. Having said that, Mount Sinai also maintains, for those patients who need to see our super specialists or need navigated care immediately, a physician access service, which South Nassau has already been using very robustly.
So bottom line on all this, if you need health care, why choose South Nassau, which is the Long Island flagship of the Mount Sinai health system?
Well, from Mount Sinai's point of view, one, it's going to represent what we believe is extraordinarily high-quality health care. Mount Sinai is one of 20 hospitals in the United States. It's a U.S. News & World Report honor roll hospital, recognizing its clinical excellence, its academic excellence, its reputational excellence. And that standard will be present for patients on Long Island. Number two, given the fact that many Americans suffer from chronic conditions, being able to provide health care for them within their community is a very important aspect of where health care needs to go. And number three, South Nassau itself sits in an essentially unique service area of almost 800,000 people, for which it is the major hospital.
Want to add to that, Dr. Sharma?
I think patients will get the best of both worlds. They'll have world-class care, and they'll get it locally. So whatever their needs are, we'll be able to accommodate them. We'll try to reduce the amount of time they spend traveling, but they'll have access to whatever it is that they need.
Well, thanks so much for coming in. This was CEO Unplugged with Dr. Sharma, the Executive Vice President for Clinical and Professional Affairs and Chief Medical Officer from South Nassau Communities Hospital, and Dr. Klein, President of Mount Sinai Health Network.